I do have some specific questions as well, if I may.
Yes, fire away.
And some of them will come from people on the things. I'm not being rude.
No,
Looking at my phone, I'll just be getting some of those out. I suppose the first one really is that I do get asked by a lot of people in clinic when I'm talking to them, should I actually try to reverse my diabetes? Is it something which you think I can cope with? What sort of parameters would you say to that for people? Obviously, there are people at different stages of their diabetes. I know that people who've had it for 10 years. I believe that there is still the possibility for them to reverse it, but is there a stage at which you'd say actually there's no point?
First of all, I'd suggest that it's important for that individual to consider how important it is for them to get rid of diabetes. Is it a matter of no longer having to take tablets? Is it a matter of no longer having to spend hours sitting in the doctor's waiting room or paying extra for health insurance? Or is it the fear of the longer term complications? Not so long term. Some people have already got them at the time of diagnosis of diabetes. There can be foot problems right from the beginning. So all of these are reasons that people may consider as being important. But are they going to be serious about this? Do they really want to do it? That would be my first question to them. And if a person says, look, I really hate my diabetes and I would do anything to get rid of it, well, that person's looking at a good chance of success. If they've just been recently diagnosed, that the chance that they will actually completely get rid of their diabetes with substantial weight loss is almost 100%. After 10 years, we're looking at probably something like 2/3 of people who lose about 15% of their weight. So that's quite substantial. People around 100 kilograms, just to make it easy, that means losing 15 kilograms or just over 2 stone.
You're looking at me now, aren't you?
It's a calculation anyone can do, and so it's quite a substantial change. So that's the first question. Do you really want to get rid of your diabetes? The second question is, what does your spouse or partner think? Are they going to support you in the weight loss? The people who've dropped out of our studies, very few out of the 45 people who've been in our most intensive studies, only 3 people have dropped out. And they've all dropped out because their partner didn't want them to lose any more weight beyond a certain point. And that might sound strange from a medical point of view, but of course, life isn't about medicine, life's about living. And there are lots of other factors. And if, for instance, you are the fat married man who's always propping up the bar telling stories, if you became thin and insubstantial, you would be regarded as being quite different. And some people don't want that change of personality. Just to illustrate it further, let me just point out an alarming thing about bariatric surgery. There's a surgical intervention that does something to a person and makes them thin. Well, thinner. The rate of divorce is alarming after bariatric surgery because one person involuntarily changes shape, becomes a different person. And if the spouse is left behind, no longer having become much more active and attractive, there are tensions. So it's got to be a family business. And that is such an important thing. It's no good knowing all about metabolism and being terribly clever about that without realising it's all about people. So as a starting point, we've got 2 questions. Do I really want to get rid of diabetes? Is my partner or spouse going to support me? That's the starting point, and everything else is secondary.
Okay, that's fantastic, really insightful and helpful.